Can you hear me okay? I'll be as fast as possible. So I'm from UareUK and the Peace Kitchen based in Wrexham. We have a refugee hub, a community garden and the Peace Kitchen. So we have refugees and asylum seekers. That's how we started. We started overseas, but we're based in Wrexham now, and we've expanded what we do to recognise that everybody's suffering, not just refugees and asylum seekers. So we spoke to the people who come to our hub through a number of means: small group discussions, one-to-ones and surveys. And the one-to-ones were done very sensitively because, well, they were very traumatic for all of us and for Nan, who supported people with them. And we're very grateful for people even sharing that with us. So the good things were that Wrexham is a place that people mostly are happy to be. People have friends. They have support networks, which are extremely important, and community resilience that's already been mentioned. But the barriers, and bear in mind, these are people who are already extremely traumatised and often on the periphery of society, especially at the moment with the rise in far right. But the barriers that came through were travel, ability to access travel at certain times. We've got people who are refugees, who've got their papers, but they're working in Chester, sometimes they can't get back, so that's a barrier. And the cost of travel. People can't afford to travel to where necessarily the services are. The needs of children. Parents are cutting back on things for themselves, or they just simply can't afford things for their children. And these are basic things. They're not luxuries, they're very, very basic things, like a pair of shoes. Childcare, so there's women who can't go to college, further themselves in their education. Food and the cost of living, I think that goes without saying at the moment. And qualifications are not recognised for refugees and asylum seekers, and they're not allowed to work, which is one of the biggest things that need to change in this country, is to allow people who've got skills and ability to put into the system and society when they want to. The impact is on people's mental health, the impact on parents not being able to provide for their children, and stress. This leads to more GP appointments, this leads to people not coming out the house, and people who have got capabilities to be part of the solution not being able to be. The solutions are right to work, access to food banks with more fresh food, access to more community meals and community spaces, help with travel costs, childcare help, and health and wellbeing support. IDA, for example, is now delivering food at the weekends because people can't access food at the weekends. That's one of our solutions. And one of our solutions is that 85% of our charity is led by the people who use it. We're not there to tell people how to do it. It's led by the people who've experienced it. So today, our cooking has been done by somebody who's now part of our employment, so we can come here and do this today. So it's about building people up and giving them skills to be part of the solutions instead of treating people as helpless. So allowing people to volunteer, more access to food surplus, strong networks, more meals, more places to be. And our solution is a circular economy that uses waste to turn into value for the community. So we are just about, hopefully, to get a grant to do that. And that's part of our solution that we would like to extend everybody to be involved with. Thank you very much.
Thanks, James.